Hello. Hello, 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 colleagues of the world, here in the tent and out on the live stream. My name is Megan Smith. I was Chief Technology Officer of the United States under President Obama. Now I'm working on a new startup. I love engineering and entrepreneurship and solving problems and finding incredibly talented people doing that and helping them. This is my colleague, Susan Alzner.
Hi, everyone. I'm Susan, head of the UN Non-Governmental Liaison Service. We help people to participate in all the formal processes at the UN, and we do special cool events like this that help the world engage in this important institution.
Yeah, so we were lucky that the United Nations, with the help of Susan and the Secretary General, Deputy Secretary General, and the office has really supported the beginning of this event, the Solutions Summit, which is an annual event. This is our third year. Thank you to the UN DPI for hosting us here in the media zone so we can be a little louder this year and share much more online. And the idea is basically we post a form and we ask you in the world, out in the world, what are you already doing to solve this incredible agenda that all of us together with the leadership of the governments and the UN have put together for our humanity, for ourselves. And it's sort of who's showing up and what are you doing? And then we get submissions. And how many do we get?
Within 2 weeks, 800 from 120 countries. And that's held steady every year.
Yeah, so every year, just an extraordinary outpouring of not ideas, but people actually doing extraordinary work already on this agenda. And the goal is, how can we make it louder? How can we as a community help those entrepreneurs? And that's what the Solution Summit is about. We give them a couple minutes on stage to give kind of that TED-style, quick burst talk about what they're doing. They can't tell us everything they're doing, but they give us a sense of it. And then we have a couple people in the audience who will come up who've been part of an accelerator group. And we'll talk about them, and they will give feedback, and pretty positive feedback. The idea is 2/3 yes and. How are you going to help this entrepreneur? What kind of funding, technology, ideas might they have? And so out there in social media, as you hear these entrepreneurs, be thinking, what would help make this idea go faster, better, broader, cheaper, all those things we need to do. So we want to accelerate them, and then we'll go to the next. So today is a day where we're focused on health and well-being. And so we have first up, Emergency.
Yeah, it's Shafti Mather. He's over here, Extraordinary Solution. And just before he gets going, it's so important, the work that you're doing. There's a statistic that 450 to 550 people are dying per day in car accidents in India. And with just a little bit of help to respond more quickly, 30% of those lives could be saved. That's a World Health Organization statistic. So people like this from around the world who are helping others in extraordinary ways with simple solutions. Thank you.
And it's amazing because so many people who have had access to emergency care are in a very different position from 90% of the world. So welcome to the stage.
Good afternoon. I'm Shafi Mather, founder of Emergency. 12 years back, my mom had a medical emergency back in India, and my dad and I had to rush her to the hospital in the back of the car, unlike what you would do here of calling a 911. By God's grace, she survived, but for the 3 days we were in the hospital in the ICU, I started asking myself, why are there no emergency ambulance services in India? That got me passionately involved in that space, and I stepped out from everything that I was doing and founded an ambulance company with 2 ambulances with 4 of my friends. And over the last 10 years, we have grown it to 3,000 plus ambulances with 10,000 plus employees, transporting on an average 12,500 plus critical patients every day, cumulatively having transported close to 7 million patients and delivered 12,000 plus babies on board because the women or the families called the ambulance late. 2 years back, I stepped back and looked at this space from outside in. And this is what you see, and this is what I saw. 90% of world population of 6.25 billion people, primarily living in South America, Africa, and Asia, do not have access to timely medical care. They do not have a number to call. If there's a number, nobody answers. If somebody answers, there's no response. With this being the situation, we looked at it, what can we do to address this? The WHO estimates show that more people die every day from lack of timely care than from AIDS, malaria, and TB combined. So the solution we proposed is we need a global 911, not literally the number 911, but one global emergency response network. And What we are proposing to do is, with one touch alert on your mobile phone, a nearby responder physically come to respond to you. How do we do this? The business model we are developing is, we're using the power of cloud technology, aggregating existing medical resources in a locality, hospitals, hospital emergency rooms, ambulances, doctors, nurses, Red Cross volunteers, etc., and using GPS, logistics, and what you usually see in Uber, Lyft, etc., we make the nearest responder come to you. We have also made the business model financially self-sustainable through a fee-for-service and accessible equally to the rich and poor through a cross-subsidy pricing regime. This is a sample screenshot of our app, which is being piloted in India right now. And for this ambitious program, we have a 5-step strategy to reach every corner of the world. Emergency is enrolling the private sector city by city in India, and as we raise more funds, we'll go global. We have partnered with the world's largest 3 ambulance company, US #1, Europe #1, and Asia #1. We have partnered with Global Red Cross and Red Crescent. We are in discussions with WHO, and we are partnering with the world's largest visa processing company to help travelers. The partners brings in 10,000 ambulances and 50,000 medics in US, 2,000 ambulances and 12,000 medics in Europe, and 3,000 ambulances and 15,000 medics in Asia. And most importantly, Red Cross brings in 160,000 physical locations and 17 million volunteers onto this network, which means that once we complete this, we will be the largest, widest, deepest human assistance network in the world. Our goal is to provide medical emergency response at the touch of your phone, anytime, anywhere, to anyone. We are more than a social network. It's not about messaging. It's about providing actual help when you face a medical emergency. Uber raised $15 billion to reach 400 cities and 1 million drivers. Airbnb spent $3 billion to reach 57,000 cities and 2.3 million listings. In under $25 million in partnership with Red Cross and Red Crescent, we believe that in 3 years, we can be in 160,000 locations and have over 4 million responders across the world responding to save lives. What we offer is, we offer the UN agencies, federal government, state government, city governments, and rural governments 2 models. One, the traditional ambulance model with the least cost and highest efficiency, and the new aggregating model with low capex and low opex. What we ask for is support from UN agencies, and especially WHO, to cut through the red tape and build this one global emergency response network globally, and support of $25 million for rolling this out globally across the next 3 years. Thank you.
Awesome. Terrific. Thank you. All right, so one of the things we try to do is help entrepreneurs. So everyone in this audience start thinking, everybody online start thinking, what would help to accelerate urgency? And come on stage, one of our colleagues. So the acceleration partners who came together, and you're going to represent some of the conversation from that room. We had everyone from MIT Solve, the Skoll Foundation, Leonardo DiCaprio Foundation, SDG Philanthropy Platform, the Yes Bank team in India, the Stanford Angels and Entrepreneurs, University of Denver, and Project Flight to Denver, and the Equator Prize, and lots of youth and other people we collected. And the idea, you guys sat together. We couldn't do the brainstorming here because you'd have to wait. So you guys sat together and talked about 2/3 yes and, how to help, and a little bit of critique. So quick thoughts on ideas we would use here.
My name is Dauda Jabarte. I'm with MIT Solve. You know, one of the things that we were talking about emergency, and it goes true for all the other solutions that we were discussing, is really trying to create a race to the top. Right, in terms of bringing out the scale, the replication, and the resources and the partners to really, really supercharge these ideas. You know, we were talking about the cost of this not happening, right? Both financial as well as on the lives of people. And you know, everyone was in awe of the solution that we're here talking about. And what I would love to see is, you know, the finance ministers coming together and really, really trying to figure out how they can support your work and how they can use your solution in their countries to save their citizens and provide that service.
Yeah. extraordinary networking, that you've developed, and how do we accelerate you. So thank you very much. All right, terrific.
Thank you.
Thank you, thank you. Okay, next up.
Mr. Kevin White, former U.S. Marine, has developed an extraordinary solution to help people, especially in developing countries, to improve their vision, because there's a shortage of diagnosticians, optometrists. There's only one optometrist, 1 per 1 million people in Africa. So he developed a kit that you can learn how to use it in a day, actually even less than that. I think I just learned in 5 minutes, to get prescription for your vision, and within 5 minutes, a pair of eyeglasses that are stylish. And now I have to share that I haven't had time to go to the optometrist myself because there's too much work at the UN. My eyes are going because of staring at screens. So I got super excited about this because I need glasses. So he's gonna.
And we figured that out with his tool. So it's awesome.
So he's gonna help me get glasses today.
We might do it right on stage while you're speaking. So the other thing, on Monday, Kevin was awarded the National Geographic Chasing Genius Award. He's the first winner in the global health area. So congratulations. So it's a two-header this week. So welcome to the stage, Kevin White.
Thank you so much. Hi, everyone. I'm Kevin White, as you heard. So worldwide, there's an estimated 2.5 billion people that need eyeglasses that suffer from poor vision. And if you suffer from poor vision, it really affects every aspect of your day-to-day life. It's difficult to learn, you can't see the chalkboard, difficult to drive. You actually become an increased burden upon your family. And it's a real challenge to live a healthful and productive life if you can't see. This epidemic affects every aspect of your life, and you become, it's difficult to overcome the challenges of a life with poor vision. But it's an easy problem to solve, right? I mean, for 500 years, we've just applied glasses to this problem, and people can see clearly. And if you need glasses, for most of us, it's very simple. You go to an optometrist, you get your eyes checked, and you're done. You get a pair of eyeglasses. But what if there was only one optometrist for every 8 million people? In parts of sub-Saharan Africa, this is a reality. And the cost of glasses is pretty cheap. So it's not the cost of glasses that's the problem. It's that there's a complete lack of infrastructure that can effectively diagnose people with poor vision, determine what the prescription for each eye is, and then provide those eyeglasses. And the existing solutions are not only complex, they're extremely expensive, and it takes years to make an eye care professional. In 2005, as you heard, I was a United States Marine, and I was planning humanitarian civic assistance operations in Africa. And my first deployment was to Morocco, and I witnessed a military unit giving away eyeglasses. They were donated eyeglasses. And as a professional logistician, I was really offended at the inefficiencies of this system. And I thought to myself, someone should do something better than this. And what I didn't know was that interaction was going to chart the next 12 years of my life. So I started Global Vision 2020 when I retired from the Marine Corps in 2009, and we started working with different technologies that could lower that educational threshold. And what I came up with was a kit that anyone can take anywhere and provide eyeglasses. And the heart of the kit is the UC, and it's a diagnostic tool that the patient simply turns the dial and determines their prescription. The kit also includes a near chart and distance chart and a user's manual. And then it comes with multiple color frames so that the patients can pick a color that they like, and then lenses that fit all needs for near distance, for near vision and for distance vision. And here's how it works. So local networks, and this is Henry, he's a community healthcare worker, he gives the patient a near chart and a distance chart test to determine best visual acuity. And we use an e-chart so we can overcome any literacy issues. And if the patient needs eyeglasses, they simply put on the UC and they turn the dial until they get their best visual acuity. You then find the lens that correlates to that power, and you snap it into one of the frames. And the frames are pretty nice, as you can see. And it really takes only a few minutes to do, and it's as simple as dial snap wear. We've already conducted extensive field trials at high schools in Mozambique using teachers as the distributors, and in Ghana using community healthcare workers and volunteers. And in just a matter of hours, These networks, these local networks, were able to screen and dispense hundreds of glasses to students that had no option before and villagers in Ghana, and provide that fix to this disability, and it really is a disability. We've already conducted clinical trials at the Wilmer Eye Institute at Johns Hopkins University and the New England College of Optometry in Boston. We are ready for full-scale, for large-scale distributions to include national programs, but we need some help to get there. We need funding to take the UC from small-scale 3D printing to full-scale injection molding. We need funding. We want to make regional kit consolidation, distribution, and training centers, and we want to staff those with local personnel. And we need to get introduced to distribution networks. As we've seen from previous deployments, ministries of health, education, and transportation are natural partners if we want to reach all the citizens of countries. And any NGO that does healthcare training, healthcare distribution, refugee support operations, or even social entrepreneur training so that we can make entrepreneurs out of the people with these kits would be great. And lastly, the regulatory assistance. Moving equipment over borders can cost a fair bit of money. If we can reduce those costs for the equipment that support this sustainable development goal, we can increase the number of people that we can reach at lower cost. This really is a simple solution, it's affordable, and it's time that we did it, and we can. Thank you so much.
Thank you. Okay, so quick, we want to show people this. So Susan's going to put on the kit that you're in the field, you put this on,
Yep.
and now you start moving the dials to see better. So look that way.
Oh, we have a near chart.
Here,
for
come
her,
look
too.
this way.
This is this cool chart. The little thing from the doctor's office. Okay.
All right, so she's going to look at this,
Yeah.
and then you hold it like
I'll
that,
there.
and then you adjust until the lens is correct.
For each eye.
Yeah.
So you close one eye, adjust it, close the other eye, adjust it.
Got to get it right, because these are going to last me for a while.
Yeah.
Okay, good.
All right.
All right, so then based on that setting, Kevin's going to look at it.
Eyes are different.
Well, yeah, so
And then right here's the kit.
That
So
one dropped
imagine
down.
someone out in the field.
So simple.
Nice.
So which one is?
Yeah, so she was a 3 right and a 3 left. It's the positive lenses for readers. You got that. And you basically just take it out of the bag, line it up.
This is pressure.
Yeah.
I used to be
Click
a
it in, I heard it click.
Snap
It's
it
like
into
these
play.
cycling glasses. Have you guys ever seen the cycling glasses you get? You can pop in different lenses for the time of day. It's the same idea.
It's yeah, exactly. Like with shade and everything.
And he got me frames to match my hair.
There you go.
And apparently this costs $2 total.
And it's got cool style.
And now I can read like a normal person because otherwise I can't. I can also see my camera, which I am a photographer, and I can never see the back of the camera anymore because my eyes are shot. What do you think? It's pretty good, right?
Congratulations, Kevin. Okay, so now we're going to have, thank you. Now we're going to have a couple acceleration partners pop up. Okay? And what would you do to accelerate? Introduce yourself.
Hi, everybody. My name is Hend. Kevin, this is amazing. And what I love about it is a couple of things. One, it's simple, and it addresses multiple global goals. And two, now you have opportunities for employment for people that are looking for that. I would encourage you to work with local community centers as a hub to attract, one, people that would like to be employed to do this, and also people that need it.
Thank you so much.
Thank you. Hello, I'm James Calvin, and actually Kevin and I have an important connection. I'm at Johns Hopkins. I'm the lead faculty for our Innovation for Humanity. Let me say, Kevin, this is totally useful around the world. You've identified sub-Saharan Africa as a starting point. I know that for all of our colleagues and the partners that you've developed, this is something we really want to get our arms around to assist you. But I do have one question, if I may. You identified where you would like to go next. So if you could talk a little bit more about how do you advance this effort and the Sustainable Development Goals going forward?
Sure. Thanks, James. So we have an agreement with the Ministry of Education and the Ministry of Health in Mozambique. So we're ready to do a full-scale deployment to Mozambique to go to all high schools and then start with the regional health coordinators and the community healthcare workers. So obviously that takes funding, and we're kind of looking for that funding now to be able to run a national program. And then in Ghana, we're there as well. And any nation that wants to solve this national problem, we're ready to talk to you.
So get in touch with Kevin. And so hashtag for us is Solutions with an S, Summit. Send us ideas there, hashtag SDGs. And we'll watch social media for ideas for you. So thank you so much, and congratulations. And again, congratulations on the National Geographic Prize. All right.
And Kevin and all of the solution makers today, what we really love about this is these are people, individuals who identified problems and just had the initiative to go and address them. And with their own creativity, Kevin's worked with a lot of volunteers in order to help realize this. It's really extraordinary what you've achieved just from your own drive to help others. Thank you.
Thank you. Okay. Next up, we have extraordinary leader, Blanche Awafak is going to come on up. She's the Chief Technology Officer at Gifted Mom. And one of the great challenges we face is with maternal health. And you guys have just done an incredible job using new media ideas and the mobile phone there. So we're going to give the stage to you. And also, I think Jay's going to come up. Jay from the United Nations Foundation, and UNF is right now running a fabulous conference. Don't leave our live stream, but when you're done, go over and check that out. But the United Nations Foundation has been a founding partner of the Solutions Summit every year, and so you guys are going to team up because you're going to speak in French, which is awesome. So welcome to the stage, and thank you for coming. Also, Susan, you have it.
Yeah, so everyone, Blanche is from Cameroon, and Cameroon is the country in the world that has the highest rate of maternal mortality. So their solution to help pregnant mothers get the health care that they need using simple SMS is really, really important. And it's another example of what happens if this doesn't exist and how important it is to scale. It's really a matter of life and death for a lot of people. So thank you for coming and joining us all the way from Cameroon, Blanche.
And also, you weren't going to say it, but 80% of the people in the urban areas have already benefited and 64% in rural. So this is very scaled.
Bien, bonsoir et merci de me passer la parole. Alors, je suis Blanche Awafak, responsable technologique à Gifted Mom. Alors, la raison d'existence de Gifted Mom, c'est de réduire le taux de mortalité infantile et maternelle en utilisant les technologies mobiles.
Good evening, and I'm very happy to be here. My name is Blanche Awafak. I'm the CTO for Gifted Mom. And our program looks to reduce infant mortality rates in Cameroon initially.
OK. D'où vient ce but, cette raison? En fait, nous nous rendons compte que près de 800 femmes enceintes meurent chaque jour et près de 1,5 million d'enfants entre 0 et 5 ans meurent de manière annuelle. Alors, nous nous rendons aussi compte que ces femmes enceintes viennent généralement des familles de bas niveau, donc elles n'ont pas accès forcément aux soins de santé et il manque carrément un canal de communication pour les atteindre. Malgré qu'il y ait des entreprises, déjà des organisations qui existent en Afrique pour pouvoir aider ces femmes. Mais puisqu'elles sont dans des populations reculées, comment est-ce qu'on peut faire pour les atteindre et résoudre ce problème de manque d'information, manque de suivi de la grossesse ou de suivi de vaccination du bien-être de l'enfant?
So the impetus behind this work is that we became aware that 800 pregnant women die every day, and 1.5 million children under 5 are at risk. And why this happens is because pregnant women do not have the information that they need and the timely information they need when they need it. So we decided to tackle this challenge head on at Gifted Mom.
OK. Alors, la solution qu'on s'est donnée, c'est... La solution que nous avons trouvée, c'est d'éduquer les femmes. Donc, on se dit, si on réussit à éduquer ces femmes qui n'ont pas accès aux soins de santé, alors le taux de mortalité infantile et maternelle peut être réduit d'environ 9,7%.
So we decided to take this challenge head on, and we started to educate pregnant women and girls, and we have been able to reduce the infant mortality rate, maternal mortality rate by 9.7%.
OK. Alors, nous sommes basés sur une solution de service mobile. Environ 85% de femmes ont accès quand même au téléphone. Donc, alors, notre solution est d'envoyer des messages éducatifs aux femmes enceintes. Des messages qui correspondent exactement à son âge de grossesse ou à l'âge du bébé. Et aussi, nous encourageons ces femmes à aller au rendez-vous de consultation prénatale ou de vaccin des enfants en les envoyant des messages de rappel de rendez-vous. Nous allons donc dans les hôpitaux, nous collectons les données des femmes et nous leur envoyons des messages de rappel gratuits. Ces messages sont gratuits, des rappels de rendez-vous. Aussi, les messages d'éducation, eux, ils sont payants. Donc, les femmes souscrivent via des services USSD et donc de manière journalière, elles reçoivent des messages, des contenus en langue locale ou en français ou en anglais en fonction de ce qui les convient.
Okay, so what we did is we essentially have a two-step approach to it. It's a mobile-based health support solution to 40,000 users. We educate women by sending them SMS messages on a regular basis. Now, they receive alerts that are free, and then we have a paid-for system that goes that follows up on that. A second one is a USSD system that we're developing and deploying, and they also receive voice alerts that help them know when they should go to the hospital, responses to some of the questions they may have about their pregnancy.
Okay. Donc, actuellement, nous sommes en Afrique et l'idée est de pouvoir aller dans toute l'Afrique en général, donc toucher tous les pays concernés par l'Afrique en utilisant bien sûr les partenaires que nous avons déjà qui nous sont essentiels, les opérateurs téléphoniques et les agrégateurs de billing pour les facturations. Dans un premier temps, nous voulons être en Afrique et puis nous voulons nous étendre dans le monde entier.
So we're currently in Cameroon, and we have great partnerships with a number of mobile providers and credits and billing seconds. Our second step is to scale into the larger Africa with those same partnerships, and then we want to go global.
Actuellement, l'équipe qui est derrière tout ce projet de Gifted Mom est essentiellement camerounaise. Donc aujourd'hui, on peut dire que l'Afrique est consciente de ses propres problèmes et déjà, elle essaye de trouver ses solutions. Donc nous recherchons des partenaires à quelque niveau que ce soit, des partenaires au niveau de la technologie, au niveau médical, aussi bien sûr des financements, mais aussi nous recherchons le soutien de ceux-là qui peuvent nous faire pénétrer facilement auprès des gouvernements de ces pays. Parce que cette solution ne peut pas se faire si le gouvernement ne donne pas son accord.
So we're a team of mostly Cameroonese Africans, and we are looking for more partners. We are aware as Africans of our own problems, and we're looking to solve our own problems, and we are looking for partners at a variety of different levels to help us scale into countries where we're not yet present. And the types of partners we're looking for: investors, mobile providers, and advice in general.
Okay, thank you.
Wonderful. Thank you so much. And I love what you just said, because what's been so terrific with the Solution Summit is finding entrepreneurs everywhere, and especially this extraordinary colleagues, you know, in Cameroon and other countries, in Africa, in Asia, Middle East, North and South America, Europe, everywhere. So it's great. So let's see, we want to get some of our acceleration teammates. Come on up. Okay. And I know Claire from United Nations Foundation also has some great social media ones as well. So I'm going to hand the mic and introduce yourself. Sure.
Thank you. I am Mario Marigo, and I work for the Equator Initiative, and specifically on gender. And I want to highlight how this is important, because we all know that women are the center of communities, families, and countries. This is not just about empowering women. This is about empowering a whole society and eventually a whole country and a whole region. Africa, and I hope other regions in the world. We're tackling health, reducing inequalities, gender equality. We are creating partnership. We're creating education. So this is a fantastic initiative. I wish you all the best.
Thank you very much.
Thanks so much. Hi, great to be here today. My name is Darash. I'm a university researcher. And just to echo a little bit, I think this is such an important challenge and a grave challenge, and I think I love the simplicity with which you guys have come up with a solution to this. I think it really helps underscore the importance of education, not just in terms of children, but also mothers and health. And I think that's something that's not often talked about, but this is a great example of how education has such a big impact in so many different ways. And I think that's really cool. I think there's a lot of potential for scale up here, obviously. I would really encourage you to kind of pursue that and really see this kind of not only be a solution in your country, but really spread across Africa and the world.
Thank you very much.
Thank you, Steve. And then we also have, is it a question? Some stuff, thank you, on social media. So hashtag solutions for the next summit, and also hashtag SDGs.
We have a question from Charlotte. Oh, hello, everyone. Hello, social media web. We have a question from Charlotte Platt. Can this initiative be scaled globally in other parts of the world with high infant maternal mortality rates?
So talking about scaling, yeah, so how to scale, it's a similar kind of, yeah.
OK, comment faire pour pouvoir étendre cette solution? Essentiellement, ce que nous avons besoin, on va dire, la technologie, elle est déjà là. Elle est déjà là. Nous avons besoin essentiellement des opérateurs téléphoniques dans les pays concernés et de la coopération de ces gouvernements-là. C'est essentiellement de ce dont nous avons besoin parce que carrément, toute notre plateforme, elle fonctionne sur Internet. Donc, Internet, c'est carrément le monde entier. Donc, nous pouvons atteindre l'extrémité du monde avec cette solution.
So quickly, yes, we can achieve other regions because technology is here already. What we really need now is investment, and we need also partners, mobile partners, for instance, and governments to pay attention to this initiative. Technology is here. There's just the need to use it.
Okay.
This is terrific, and it's such an example, I think a little bit about venture capital. And venture capital fuels entrepreneurs. Sometimes you can think about the monies from the philanthropy sectors, the government sectors, other sectors who are purchasing, procuring different kinds of solutions. That can be a kind of venture capital in a way, right? Because that can come, if they come and start purchasing, as you're saying, in different regions, the incredible solution you already have working, then it's a way to scale more rapidly. It builds your solution. Others can come into the market too, and we can scale very rapidly. So sort of venture catalyzing in that form. So thank you very much, and congratulations. Okay. Next up, one of the other things actually Blanche and I spoke about is just the use of machine learning and artificial intelligence and data science. And as they're using, right now they're using really the messaging side of this and that, but as they're collecting and learning more of about the group in aggregate using privacy, they will really be able to see and learn and really improve the quality of care using what they're learning, what people know and don't know. So thinking about AI and machine learning in this context, which I know your company is considering for the next future, is really significant. So thank you.
There's also a really huge added benefit of the fact that you have the voice messaging aspect to your technology, which allows different dialects, different indigenous languages in Africa to have access to this kind of support. So it's really commendable.
Yeah, and getting around literacy as people learn. So thank you. Okay, next up, farmer check.
Yeah, so Mr. Mohammed Zaman is here with his children. He brought his children as well. So he's an important leader at the University of Boston, professor, and another initiator of a vital solution, which is a testing mechanism that costs less than $1,000 a day in order to be able to evaluate counterfeit or substandard or poor quality medicines, which are costing $15 billion annually in loss of life, as well as drug resistance impacts. And one of the most important of those is antimicrobial resistance, which is an issue that the UN is really looking closely at right now. We're facing a crisis in that regard. So the ability to test medicines like this rapidly and in developing country context in a portable kit is vital.
And especially what you guys have innovated, which is clear, is paying attention to how are we going to reduce the cost, the size, everything, and get this to be available anywhere. There could be counterfeit drugs available. Someone would accidentally take them and not get well. So welcome to the stage.
Great. Thank you so much. Thank you so much. My name is Mohammed Zaman. I'm a professor of biomedical engineering at Boston University. You know, all of us get sick for one reason or another, and our ability to get better or get a cure depends not only on reaching the healthcare facility on time and making sure that the diagnosis is accurate, it also depends on getting the right drug at the right time, something that helps in the healing process, something that makes us get better. Now, unfortunately, this luxury of quality medicines is not available to a significant part of the planet, including in my own country, in Pakistan, where growing up, I knew dozens of stories of challenges people faced because of poor quality medicines. Now, poor quality medicines come in all forms and shapes and mechanisms. So on our top left, we see poor manufacturing, things that shouldn't be done, things that are dangerous, costly to the lives of people. Medicines that are stored improperly, that lead to degradation, issues of intentional falsification, misleading the naive consumer, and of course, things available without any checks and balances. All of these make the problem a truly global phenomenon. Anywhere from 10 to 30% of all drugs available on the planet may be counterfeit, substandard, degraded, or poor quality. It accounts for about $75 billion annually and leads to the loss of life of about 700,000, 750,000 people every year. And this doesn't even add up and include the people who are now exposed to antimicrobial resistance at all parts of the planet, whether you're in New Delhi or in New York. Out of this came PharmaCheck, with a fundamental belief that no matter who you are, where you live, what you look like, how much you earn, you should be able to get quality medicine when you need it. And there should be no compromise on this whatsoever. PharmaCheck is a portable suitcase and is a mechanism to tackle the problem of poor quality, falsified and counterfeit medicines in a manner that is affordable, easy to use, rapid, and quantitative. We want to go beyond the only yes or a no answer, whether there's some drug available in this or not. We want to be able to tell it quantitatively, whether it is 83% or 90%, whether the drug is going to release at the right time or not, and do so at all points in the supply chain. But you know, the most important thing is to empower people in their communities and their countries. So this is Alfred, a colleague of ours and a friend of ours who we have worked with closely in Ghana. For him to get trained on something that wouldn't take weeks, but in fact only takes 15 minutes, and test the drug from start to finish and develop the confidence that he can trust the system, that he can test the drugs that he and his kids are going to get, is one of the most empowering things. So we want to sort of develop a new gold standard in the field that is quantitative, that gets you the relevant results that are relevant in your country, in your community, and above all, decrease the cost so that it becomes affordable for everyone. So the question is, how does it fit into the system? Because we don't want to create a new system. We want to empower and strengthen the existing system. The existing system, unfortunately, doesn't do any testing. Or if it does testing, it is ad hoc. Sometimes happens, sometimes doesn't. Happens at one point and not the other. With PharmaCheck, we want to be able to do that at all points that may be vulnerable, so that we can strengthen the system so that nobody at all is affected by poor quality medicines. So where do we go from there? So our ask is three things. We want to develop new relationships in country to ensure that we understand the context and be able to provide solutions that are relevant to you. We also are looking for partners that allow us to increase the breadth and the depth of our platform so we can solve the problems, whether they are in malaria or in TB, in antibiotics or in other life-saving drugs. And finally, we want to work with regulators, with ministries of health, with other groups who are able to help us navigate the landscape of regulation so that the solutions that are provided are not just for today and tomorrow, but are sustainable and are going to be there from 10, 20, and 100 years from now. Thank you very much.
Awesome. Thank you. This is so important. All right, so we have a couple acceleration partners. I see Nina from Project Excite. I also think we have an addition to this acceleration. Canada takes the stage. So this idea of grand challenges, just to pause for a minute, is really open innovation, which is what we're kind of role modeling here, and really, looking out in the world for who's got ideas. So in this particular one, so let's go introduce yourself and then give us some input.
Hi, I'm Nina Sharma. I'm the Managing Director at Project Excite at the University of Denver. It's exciting to see another university up here. I think what we discussed a little bit in the acceleration session yesterday was figuring out ways to get the actual end user involved in this process or aware of this process. I'm not sure they actually know that this is an issue, and it's something that you could get a groundswell behind. To have a product like this, it's really useful and really scalable. And then the other thing is figuring out ways to insert yourself in all pieces of the supply chain. So not just at the very end, but figuring out where breakdowns happen and partner with those different pieces of the supply chain along the way.
Great. I'm Peter Singer. I'm the CEO of Grand Challenges Canada. And I just wanted to say, Mohammed, such an exciting innovation. We've invested in this through Saving Lives at Birth. So if we did it, you can do it. So please take out your checkbook. What I like about this is and the relationships. What I like about this is that it cuts across such a wide range of problems. It's almost like a platform technology in a sense, antimicrobial resistance, malaria, et cetera. My question actually isn't for you, it's for your kids. Could we get them to come up here?
Yeah, so we have some special guests who are coming up, and welcome. So one of the things we love at the UN that Susan shared with me and some of my colleagues here who work at the UN is whenever children come. And so these guys luckily joined their father here. And so a quick question, and also the other thing is supporting your father is so great. So go ahead.
Well, Megan, that's what I wanted to ask. I mean, we are all so proud of your dad, and I just wanted to know what you thought of what he was doing.
Definitely, we're also very proud of him. It's very exciting to be here at the UN. It's always been a fascination for me to come here.
I also think it's really nice to come to the UN, and I think it's very cool what my dad is doing.
Great. So let's give it up for these kids first, Megan, before you go on. All right, over to you.
Well, what's also cool is also your mom is doing something in engineering, yes?
So like Megan, she's an MIT lifer, came as an undergrad to MIT and still hasn't been able to leave the institute after, I would say, N number of years, with N is greater than 20. So she works on a number of very interesting things. So she's trained as a mechanical engineer and then did her PhD in aerospace systems. So she's a true rocket scientist in many ways. She works on large-scale energy and water systems, looking at how to make them better, how to sort of address the challenges, including in many in the developing world.
So this is quite a fast-forward family. So one of the things that's great is having university leadership here and Grand Challenge thinking, which is really coming into the curriculum of universities. You know, I mentioned yesterday the XQ Super Schools Challenge, XQ Super Schools, which is Lorraine Jobs' work, to have a movement to make our schools so much more fun. And we were talking, how do you adapt the curriculum so that in every class, the students could feel that there's something related to the Sustainable Development Goals that this class could solve. And it's interesting to have, you know, University of Denver, you guys are doing Project Excite, which you might describe just quickly.
Yeah, so Project Excite is it's a university initiative that sits across all parts of the university, not just the business school or engineering school. It's a cross-disciplinary program that engages students, faculty, and the broader community in innovation, tech, and entrepreneurship, and really serves as a bridge between everything that's happening on campus and everything that's happening in the Denver and broader innovation ecosystems.
And it's so collaborative and workshop-like, and you guys invited the Solution Summit winners from the past 2 years out to Denver, and you're doing it again in there. And I know we talked about, you know, doing this in the classroom. So it's sort of how do we as a network, from our youth to our eldest elders, get together in a network to accelerate the entrepreneurial ideas that each of us have. And given that there's so many different topics, there's plenty of exciting things for 7 billion people to work on. And so thinking of everybody as co-collaborators is sort of the point of the Solution Summit. And so thank you to all of you guys. It's terrific to have this.
Thank you.
So we have just a couple minutes left, and so we wanted to do a couple quick things to end. One of the things I wanted to share is just this idea of play the whole orchestra. So depending on what sector you work in, you sometimes think of what the tools that would be relevant for it. So if I work in government, I might think that the main tools are policy. And if I work over in engineering, I might think that it's some kind of mathematics or invention. If I work in law, it's law. But what if we had all those people working together on problems and mixing up the methodologies? Just like on any problem, you don't want to, if you're playing a piece for an orchestra, you don't want only the strings to play the whole time. You don't want only the brass to play. You don't want only the percussion to play. That is great for pieces of it, and there's different moments where one is more important in the methods. But really, if we want to solve the Sustainable Development Goals rapidly, we can scout and scale for those who are already working on these things and use the whole orchestra together to accelerate our work. What's so cool is that we've, as humanity, invented the internet together, which is really just us connected. And so using that technology, whether it's to serve those who will give birth to the next generations, which is what Gifted Mom is doing, or serve those in foster care, or those who need help with medicines, or those who need eyeglasses, to connect us on all these solutions that are not digital, but using the digital networks to connect each other, to accelerate this stuff. And so we really want to thank sort of the teams here at the UN for bringing this new model of collaboration into what is, and modernizing the UN in this way.
Yeah, and on the subject of playing the whole orchestra, the way the decision-making worked to select all the solutions that you've seen the last 3 days, this was also an open and participatory process. We let the world apply to be on the selection committee. It wasn't the UN receiving all the applications and deciding from our institutional basis. So we had 25 people from all around the world with all different types of expertise, regionally balanced and gender balanced, with a diversity of expertise on different SDGs, come together and work as a group to read. We had more than, I don't even know how many, 800 applications, and they had to do it in a week. And we think that's good too, because the UN is always having to deal with tsunamis of information, so it exposes more and more people to how the UN works. And the last important thing on this is that selection committees tend to mirror themselves, so it's always important to remember that it needs to be fully representative in your committees when you're running processes like this, so that the outcome is also regionally balanced, gender balanced, and has a diversity of constituencies and expertise.
It's really using the network to lift the network. So let's invite our solution makers from today up on stage. Come on back up, and we'll give them a last round. I think one of them just popped out to get an interview, but hopefully we'll get them. Come on up. And then where's Jay and Claire and some of our other colleagues? And then let's actually pull up. So first off, let's say thank you to you guys. Congratulations.
Yeah. Woo! Total superheroes.
And then United Nations Foundation, our acceleration partners, come on up, and we'll just close with a big thank you for everybody. Let's see, one of the things about acceleration partners is that we blasted around emails asking, and we ended up with extraordinary partners. I read some of them earlier. I can do that quick again. Well, you guys are coming up. Some of our selection committee. We saw the teams from Leonardo DiCaprio Foundation, the Skoll Foundation, SDG Philanthropy Platform, Yes Bank, Stanford Angels and Entrepreneurs, University of Denver, the Equator Prize, the Grand Challenge Canada has joined us, MIT Solve, Youth, and others. So thank you so much to everybody who joined us, and thank you everybody who collaborated as a network to accelerate our incredible entrepreneurs. And we'll see you again next year on the fourth one.
Everybody copy this.